The last week of December. More people die from heart attacks during the last week of December than any other time of year, as per a study conducted by the American Heart Association. While the holidays are a time of joy and togetherness for many, they are also time when serious cardiac events peak. The Health Organization recently highlighted previous research finding that more cardiac deaths happen in the United States on December 25th compared with any other day, followed by December 26th and January 1st. The analysis was based on examination of a national database of all deaths in the United States over 28 years between 1973 and 2001. This year, holiday heart attack risk was even greater because the Christmas was on Monday. Serious heart attacks are more likely to occur on Mondays than any other day of week, according to a study presented at the British Cardiovascular Society conference in the summer of 2023. Looking at the records of more than 10,000 individuals in Ireland who were hospitalized with a complete blockage of a major coronary artery, scientists determined that the risk of such an event was 13% higher on Mondays compared with other days of the week. Factors that contribute to holiday heart. The exact reasons behind the heightened Christmas risk aren't entirely known, but health authorities suspect that greater anxiety and overindulgence in rich foods and drinks may play a role. As per an associate professor in cardiovascular medicine with Stanford Healthcare American Heart Association, all these risk factors are enhanced around the holidays. People are drinking more alcohol, not watching their diet, and they are under a lot more stress due to planning, socializing, traveling, and busy schedules. And they all contribute to a phenomena what we call as a holiday heart. Other elements that increase the possibility of heart troubles include cold weather, which can restrict arteries, and the spread of respiratory illnesses such as flu, COVID, and RSV, which can all put greater demands on heart functions. So it's recommended that don't ignore symptoms and stay in tune with how you feel. Health experts say that people dismiss symptoms or put off addressing the symptoms because it's busy time of the year. Although no one wants to spend time in a doctor's office or hospital during the holidays. The American Heart Association reminds the public that healthcare providers are ready to help no matter the season, and seeking medical attention can save your life. A lot of people confuse symptoms of heart attack and stroke. Recognizing the signs of heart attack or stroke is vital, but they differ somewhat. The symptoms of heart attack as per the American Heart Association include discomfort in the chest or other areas of the upper body, such as arms, stomach, shoulders, neck, or jaw, shortness of breath, breaking out in cold sweat, lightheadedness, or nausea. Stroke symptoms, on the other hand, according to the American Heart Association, include face drooping, weakness or numbness in one arm, confusion or slurred speech, difficulty walking or seeing, and a severe headache. Health professionals advise people who have heart disease or risk factors for heart trouble like high blood pressure to stay on top of their health maintenance. They recommend to always remember to take your medications every day just as you would, and continue to prioritize healthful habits just as you have during the year. So there are some healthy heart tips for the holidays. The American Heart Association offers a few suggestions to help keep heart trouble away at the holidays. So the number one is to stay active. The American Heart Association recommends at least 150 minutes of physical activity per week, and this number usually drops during the hustle and bustle of the holidays. You might consider starting a tradition of taking a walk before or after a big meal, as per medical experts at American Heart Association, who adds that there are many ways to get some exercise with family and friends. The second recommendation is to celebrate in moderation. While it's okay to indulge in treats and drink to some extent, AHA stresses to not overdo it. Try reaching for a fruit to satisfy the sweet craving, and be aware of your salt intake. And the last one is to take time for yourself. Be sure to make room in a busy holiday schedule to do activities that help you de-stress, such as doing yoga, taking a walk, or reading a book. Experts recommend to be mindful and take care of your mental health, and a few minutes to wake up a little bit early and take some time for yourself. So that's all for today. To keep yourself updated with all the latest medical science, please do subscribe the channel and have a great day ahead. Signing off for now. Thank you.